Good morning, student. Today we are going to study about the next section of femoral triangle, that are the contents of the femoral triangle. We are going to discuss about femoral sheath, femoral canal and femoral vessels. The objective of today's lecture is to understand the boundaries and content of femoral sheath and femoral canal, to describe the course, relations and branches of femoral vessels, and to discuss about the clinical aspect of femoral vessels. So femoral sheath, this is a funnel shaped sleeve that covers the upper 3 to 4 centimeter of the femoral vessels. It is derived from fascia transversalis. Anteriorly and posteriorly, fascia iliacus forms the posterior wall of the femoral sheath. Then it surrounds the femoral vessels just 2.5 centimeter below the inguinal ligament. As you can see in the diagram, this is the inguinal ligament and this is the femoral sheath covering the femoral vessels. The femoral sheath is divided into 3 compartments by the septas, and these compartments are lateral compartment, which contains femoral artery along with the femoral branch of genitofemoral nerve, middle compartment, which is the venous compartment, it contains femoral vein, and the medial most compartment, the femoral canal. The femoral sheath is anteriorly pierced by the femoral branch of genitofemoral nerve, and medially this is pierced by the great saphenous vein as it joins the femoral vein in the femoral triangle. The femoral canal is an anatomical compartment which is located in the medial aspect of the femoral sheath. This is the smallest compartment of the femoral sheath and it is 1.5 centimeter in length and 1.5 centimeter at base. The femoral canal is located in the anterior thigh within the femoral triangle, and it can be thought of as a conical shaped compartment which contains lymphatics and deep inguinal lymph nodes. Now this femoral canal is bounded by a femoral ring at the upper aspect, that is the base of the femoral canal forms femoral ring, and there are 4 boundaries of the femoral ring. Laterally it is bounded by the femoral vein, medially it is bounded by the lacunar ligament, anteriorly it is bounded by the inguinal ligament, and posteriorly by the pectineal ligament, superior emi of the pubis and pectineus muscle. So as you can see in the diagram, these are the boundaries of the femoral ring. Anteriorly it is bounded by the inguinal ligament, posteriorly by the muscle which is pectineus muscle, then laterally by the femoral vein, and medially by the extension of the inguinal ligament which is lacunar ligament. Now femoral ring is closed upwards by the condensation of the extraperitoneal connective tissue layer which is known as femoral septum. Now this septum from above shows a depression which is known as femoral fossa, and the septum is pierced by the lymphatics which exits through the femoral septum. Now what are the contents of femoral canal? This femoral canal, as we have already discussed, it contains lymphatic vessels and it contains deep inguinal lymph nodes which are also known as Clockett's lymph nodes or Rosenmoner lymph nodes, and also it contains loose areolar connective tissue. Now the empty space of this canal allows the distension of the femoral vein, so it can cope with the increased venous return or increased intra-abdominal pressure. Now the next topic is femoral artery. The femoral artery is the extension of the external iliac artery. It continues as femoral artery just behind the inguinal ligament, and we can compress femoral artery at mid-inguinal point. Now what is the course of the femoral artery? Femoral artery, it continues from behind the inguinal ligament downwards in the femoral triangle. It travels from the lateral side to the medial side, from the base of the femoral triangle towards the apex of the femoral triangle, and it continues into the adductor canal, and then it pierces the adductor magnus muscles, and just behind the knee joint it continues as popliteal artery. So this femoral artery, it is a continuation of external iliac artery. It continues as femoral artery just behind the inguinal ligament. It drops downwards, runs downwards and medially from the base till the apex, from the femoral triangle into the adductor canal, and then it pierces the adductor magnus muscle to continue as popliteal artery. Now what is the difference between the mid-inguinal point and midpoint of inguinal ligament? We know that we can compress now femoral artery at the mid-inguinal point. This is the point which is the midpoint between an imaginary line extending from anterior superior iliac spine of the pubis till the pubic symphysis. Whereas midpoint of inguinal ligament is the midpoint of inguinal ligament which extends from the anterior superior iliac spine till the pubic tubercle. So what is the surface marking of the femoral artery? It is mid-inguinal point. So this is the diagram showing the course of the femoral artery as we have discussed, from the base of the femoral triangle to the adductor canal, and behind it continues as popliteal artery. Now what are the branches of femoral artery in the femoral triangle? This femoral artery has 3 superficial branches and 3 deep branches. The 3 superficial branches are superficial external pudendal artery, which supplies the skin of the external genitalia. Then this is superficial epigastric artery that runs upwards and supplies the skin around the lower part of anterior abdominal wall, and superficial circumflex iliac artery that runs upwards and laterally and supply the skin over the iliac crest. Then there are 3 deep arteries. The main artery is the profunda femoris, which is given 4 cm below the inguinal ligament. Then the second deep artery is deep external pudendal, which passes below the spermatic cord or round ligament of uterus and supplies the scrotum and labius majora. And the last one is the muscular artery that supplies the muscles in the anterior and posterior and the medial compartment of the thigh. Now profunda femoris, this is the largest branch of the femoral artery. It is given on the lateral side 4 to 5 cm below the inguinal ligament. Now again it gives 3 main branches: lateral circumflex artery, medial circumflex artery and perforating arteries. These perforating arteries are 3 in numbers, and profunda femoris, it itself continues as 4th perforating artery. Now medial circumflex artery is given on the medial side. It runs just between the pectineus and psoas major muscles medially, and it gives off 3 branches: acetabular branch upwards and ascending and a transverse branch. These branches runs upwards and they supply greater trochanter and head of the femur. Lateral circumflex, it is given on the lateral aspect. It runs behind the sartorius and rectus femoris muscle, and then it gives 3 branches: ascending branch which runs upwards and supplies the hip joint and also greater trochanter of the femur. Then transverse branch that runs behind the this vastus lateralis, just behind the vastus lateralis, and participates in the cruciate anastomosis which is present on the back of the thigh. Then descending branch of lateral circumflex, it runs downwards on the anterior margin of the vastus lateralis and it supplies the muscles in that particular area. Then there are 3 perforating arteries, as you can see in the diagram. The first perforating artery is given just above the upper border of the pectineus muscle. The second perforating artery is given at the lower border of the pectineus muscle, and third perforating artery is given over the adductor longus muscle, and profunda femoris itself continues as the 4th perforating artery. femoral vein. Now femoral vein begins at the adductor tendinous opening. As we have discussed that femoral artery continues from the base of the femoral triangle till the adductor canal. It pierces the adductor magnus. From the adductor hiatus it enters into the popliteal fossa and continues as popliteal artery. Likewise the femoral vein, it is the continuation of the popliteal vein. It will enter into the adductor canal through the adductor hiatus, and then from the adductor hiatus it will enter into the femoral triangle and continues as femoral vein. Now the veins draining into the femoral vein are the popliteal vein, great saphenous vein, and the veins accompanying the branches of the femoral artery ultimately drains into the femoral vein. Then femoral vein continues upwards just behind the inguinal ligament. It will continues as external iliac vein. Now applied section of the femoral artery. The staph wound femoral vessels, actually the staph wound at the apex of the femoral triangle may cut all the large vessels. So as we know, the large vessels of the lower limb are present in the femoral triangle. So any staph wound will result into a fatal hemorrhage. Then femoral artery is quite superficial in the femoral triangle, so we can use this for the ligation. Catheters are also passed upwards till the heart of a certain minor operation that we are going to see in the next slide, how catheters are passed upwards into the coronary arteries. Then femoral vein is superficial in the femoral triangle. So in infants it is commonly used for the intravenous infusions. Femoral pulse can be felt just above the mid-inguinal point. Now what is mid-inguinal point? It is the point between the anterior superior iliac spine and pubic symphysis. Then this is something that you have to remember. Now the femoral artery crosses exactly midway between the pubis symphysis and anterior superior iliac spine. The presence of femoral pulse means that blood is reaching the lower extremity, and any absence or feebleness in the femoral pulse may signify that there is some kind of narrowing or there is coarctation of the aorta. Now this is where you have to feel the femoral pulse just above the mid-inguinal point. Now the next is cardiac catheterization. Cardiac catheterization, in this we insert catheters in the peripheral blood vessels, like in the arm it is antecubital artery is used for the insertion of the catheters, and likewise in the lower limb femoral artery is used commonly. In the coronary angiography, the catheter is passed through the femoral artery, then it is pushed upwards through the external iliac artery. From there it goes into the abdominal aorta, from abdominal aorta into the arch of aorta, and then into the coronary artery. So a radioactive dye is injected into the coronary vessels, and any wall thickening or blockage can be visualized with the help of an X-ray aid. Now these are the steps that is shown in the coronary angioplasty. In angiography is a diagnostic procedure and angioplasty is a therapeutic procedure. In angioplasty, a balloon with stent is inserted through the femoral artery. As you can see, this is the blockage of the coronary artery. Then we insert a catheter which has a balloon at its tip and along with the stent. Now when it is inserted into the coronary artery, the balloon is inflated, so which causes expansion of the stent, and afterwards this balloon is removed and stent is there, and it expands the wall so that the blood flow can be normal. So this is the clinical significance of coronary artery. And also sometimes we also use the femoral artery in embalming. Usually carotid artery is used, but sometimes if there is difficulty, there is rupture this carotid artery, then we can also use femoral artery during embalming procedure. So this completes our topic today, and we will continue with the next part of the topic, that is the femoral hernia and deep inguinal lymph nodes, in our next class. Thank you.